Penelope has her first cold. She's around 9 weeks old now. And one big thing you'll notice with colds is they get super congested. Babies are obligatory nose breathers, which means they have a hard time coordinating breathing through their mouth. So feeding and sleeping can get difficult at times for them. So one awesome trick to use is to help remove some of that congestion. Most important times before eating and sleeping, like I said, is when the most times they have issues. You want to try to keep it to a minimum. So if they're not having issues with feeding or sleeping, you don't want to do anything. You can run a humidifier at night in the baby's room, wherever they're sleeping, to help kind of moisten the air and make the breathing a little bit easier. But if they do have a bunch of congestion that is causing issues with their breathing, the best thing is to suction some out. So what we first like to do is take some saline spray water that we just put in a dropper, and you just put a couple drops in their nose. So we're gonna tilt her back and make sure we get a couple of those drops in there. She may not like it, but what it does, it'll loosen up some of the boogies that she has up there, and we'll put it on each side. Hey, Penny, good job. Let it sit in there for a second. And the one thing we like to use, even though we don't talk about name brands, this is the Nose Frida. And this is a test tube looking thing that connects a suction to it. It does a much greater job at getting some of that congestion out and some of the phlegm that they're creating. You'll recognize this as something that you get sent home from the hospital. It's not my favorite thing to use because a lot of times when you suction things out, it just stays in that bulb and it's very hard to clean. If you ever cut one open after using it repeatedly, there can be just fungal growth and mold in there. So I don't recommend this. So go ahead and pick up a Nose Frida from a store. You want to get a really good seal around the nose and not suck too hard. And you can blow some of those boogies that come out of the nose. We'll do it again. And we're able to get some of that stuff out. I know it seems gross, but this is your baby. You love them, you'll do anything for them. That's one way to help them breathe and feed better, and even sleep better at night. Hope that helps.